Hello there and welcome back to the channel. I'm Dr. Grace Holloway, and for over 20 years now, I've been working in men's health right here in the States, helping folks just like you navigate the changes that come with getting older. I've sat across from thousands of men in my office, and I can tell you something important right off the bat. What you're going through is more common than you think, and you are absolutely not alone. Today, we're going to have an honest, grown-up conversation about something a lot of men are too embarrassed to bring up, even with their own doctor. We're talking about erectile difficulties, decreased sensitivity, and that quiet anxiety that creeps in before intimacy with your partner. If you're a man over 60 or even pushing 50 and you've noticed things just aren't working the way they used to, I want you to stick with me through this whole video, because what I'm about to share with you might just be the missing piece you've been looking for. Now, before I go any further, let me be crystal clear about what this video is and what it isn't. This is medical education from a licensed practitioner. We're going to discuss therapeutic massage techniques, the kind of thing I've recommended to my own patients for years as part of a broader wellness plan. This isn't about anything inappropriate. This is about reclaiming your health, your confidence, and your quality of life using nothing more than your own two hands and a little bit of know-how. So, here's what we're going to cover today. I'm going to explain why these changes happen as we age, walk you through 3 specific therapeutic techniques, give you a simple 7-day plan to follow, and then answer some of the most common questions I've been getting from viewers in the comments. Grab a cup of coffee, get comfortable, and let's dive in. First things first, let's talk about why this happens. I want you to understand something fundamental. Erectile difficulties after 60 are not a personal failure. They're not a sign that you're less of a man. They're a physiological reality, and they have very real, very identifiable causes. As we get older, our vascular system, that's the network of blood vessels throughout your body, becomes less elastic. The arteries that carry blood to the pelvic region get a little stiffer, a little narrower. On top of that, many of the medications we take in our later years, things for blood pressure, cholesterol, depression, prostate issues, can have side effects that impact sexual function. Add in poor sleep, chronic stress, and maybe a few extra pounds around the middle, and you've got a recipe for exactly what so many of you are experiencing. Here's the simple truth. When blood flows freely and your mind is calm, an erection happens naturally. When circulation is sluggish and your body is stuck in that constant fight or flight mode, things just don't cooperate. That's where therapeutic massage comes in as a simple but remarkably effective tool to tip the scales back in your favor. Now, let me be very specific about what therapeutic penile massage actually is, because I know there's a lot of confusion out there. This is not about forcing an erection. This is not about quick stimulation. Think of it the way you'd think about physical therapy for a sore shoulder or a stiff knee. We're talking about gentle, gradual, mindful pressure applied to the structures that control blood flow into and out of the organ. The goal is to retrain your body to respond with less effort, to open up those blood vessels, to relax the pelvic muscles, and to wake up the nerve receptors that may have gone a bit dormant over the years. I want you to think of this as physical therapy for an essential part of your body, not as some kind of casual stimulation. There's a real difference, and that difference matters. Why does this work especially well after 60? Well, the male organ functions a lot like a sponge. It fills up when blood can enter easily, and it stays firm when the supporting muscles hold that blood in place. Gentle, regular massage helps widen those blood vessels, restores tissue elasticity, and trains your body to manage blood flow more efficiently. Just as importantly, it reduces what I call performance hypervigilance, that exhausting mental habit of monitoring every little sensation and worrying about whether things are going to work. When you take performance pressure off the table and treat this as therapy rather than a test, your nervous system can finally relax. Now, before we get to the techniques themselves, I have to spend some time on safety, because this is non-negotiable. If at any point during these exercises you feel sharp pain, burning, persistent ringing or numbness, or sudden loss of sensation, stop immediately and consult your physician. Do not push through discomfort. Your body is telling you something important. You should not start this practice if you have any of the following conditions: an active urinary tract infection, open cuts or skin tears in the area, severe pelvic pain, active prostatitis, or if you're currently taking blood thinners like warfarin or Eliquis. If you've recently had surgery in the pelvic region, If you're undergoing chemotherapy, or if you have any concerns at all, please talk to your doctor first. I always tell my patients, when in doubt, check it out. A quick conversation with your primary care doc or urologist can save you a lot of trouble down the road. All right, with all that said, let's get into the 3 core techniques. I'm going to walk you through each one carefully, and I want you to start slow. You don't need any special equipment, no gadgets you saw advertised on late night TV, no expensive creams. Just your hands, a little bit of quiet time, and a basic fragrance-free lubricant from your local pharmacy. Brands like KY Jelly or a simple water-based lubricant work just fine. Stay away from anything with menthol, cinnamon, or warming agents because the skin in this area becomes more sensitive as we age, and those products can cause irritation. Technique number 1 is what I call rhythmic pressure. This is the foundation, and it's all about inviting blood into the area in a calm, controlled way. Here's how you do it. Apply a small amount of your lubricant. Wrap your full hand around the shaft of the organ, using your whole palm rather than just your fingertips. Apply gentle, steady pressure for about 3 seconds. Then release the pressure for 3 seconds. That's 1 cycle. Move slowly from the base toward the middle, then back down again. Repeat this 8 to 10 times. I want you to picture it this way. You're not squeezing, you're not milking, you're inviting blood to flow in and stay a while. If you start to feel a noticeable pulse or a warm, comfortable sensation, that's a good sign. That means circulation is responding. That's your body saying, hey, this feels nice. Let's keep going. Technique number 2 is the ring slide. This one is designed to wake up those nerve receptors and improve sensitivity, which, as I mentioned earlier, tends to fade with age. Form a loose ring with your index finger and thumb at the base of the organ. Gently slide that ring upward toward the middle, almost like you're guiding blood flow forward. Keep the pressure light. We're not trying to grip hard here. Avoid any sudden movements, and if you have any sensitive areas, particularly around the frenulum, that little band of tissue on the underside, just go around it. Repeat 6 to 8 slides per set and do 2 or 3 sets. If you feel a slight tingling sensation, that's your nerves coming back online. Don't increase the pressure, just maintain that steady, even rhythm. Less is more here, folks. Technique number 3 is perineal stimulation. The perineum is the area between the genitals and the anus, and it's loaded with nerves and blood vessels. This is one of those underappreciated zones that can make a real difference in stability and stamina. Using 2 fingertips with a little lubricant, apply gentle circular pressure for 1 to 2 minutes. Sets. This area helps regulate venous outflow. That's how blood leaves the area, and it helps relax the pelvic floor muscles that support firmness without strain. A quick note. If you have hemorrhoids or any anal pain, avoid direct pressure on the central area. Just work the sides where there's no discomfort. And as always, if anything hurts, stop. So, to recap, we've got 3 techniques: rhythmic pressure for circulation, the ring slide for sensitivity, and perineal stimulation for stability. 3 pieces of the same puzzle. Now, let's talk about how to put this into a real routine that fits into your life. I recommend starting with just 10 minutes, 3 to 4 times per week. That's it. You don't need to do this every single day, and you absolutely should not overdo it. I had a viewer comment recently that he was doing this for 30 minutes every single day for 2 months straight, using a mixture of olive oil, fenugreek oil, and frankincense oil. I want to address this directly because I know a lot of you are wondering about it. Here's my professional advice. 30 minutes daily is way too much. More is not better in this case. Excessive massage can actually decrease sensitivity, cause tissue irritation, and create the very problems you're trying to solve. As for those oils, while olive oil is generally safe on skin, herbal oils like fenugreek and frankincense can cause irritation in sensitive areas, and they're not formulated for genital tissue. Stick with a plain water-based lubricant from the drugstore. Your tissues will thank you. Pick a time when you're calm and relaxed. Not right before bed when you're exhausted. Not right after a big meal, not when you've just had 3 cups of coffee and your heart is racing. Pick a quiet morning, a relaxed afternoon, whatever works for your schedule. Here's a sample 10-minute routine. 2 minutes of slow, deep breathing. Breathe in for 4 counts, out for 6 counts. 3 to 4 minutes of rhythmic pressure. 2 to 3 minutes of the ring slide. 1 to 2 minutes of perineal stimulation. Finish with 1 minute of breathing. If an erection happens during the session, that's wonderful. If it doesn't, no problem at all. Remember, the goal here is training, not performance. You're not taking a test, you're rehabilitating a system. After 2 weeks, take stock. If you're feeling a good response, keep going at the same pace. If you want to advance, add 2 minutes to each segment. Consistency beats intensity every single time. I'd rather see you do 10 focused minutes 3 times a week for 3 months than 30 minutes daily for 2 weeks before you burn out and quit. If you have a partner, and many of you have asked me about this, involving them can be wonderful. Sharing this journey with someone you love reduces stress, adds variety, and takes the performance pressure off. Talk openly with your wife or partner about how you're feeling, where you need more or less pressure, what feels good. Trust and connection do incredible things for sexual response. After 30 or 40 years of marriage, this can actually become a beautiful new chapter rather than something to feel embarrassed about. Now let me cover some common mistakes I see, because I want you to do this right. Mistake number 1 is using too much pressure. I know, we men sometimes think more force equals better results. Not here. Excessive pressure causes tiny irritations, can numb the area, and may actually weaken sensitivity over time. Light and steady wins the race. Mistake number 2 is using the wrong products. Skin in older adults is more delicate. Stay away from scented oils, warming gels, anything with strong herbs. Plain water-based lubricant is your best friend. Mistake number 3 is rushing. Your nervous system doesn't respond to hurry. It needs safety signals. If you only have 3 minutes today, spend those 3 minutes on breathing and gentle pressure. Don't try to cram the whole protocol into a short window. Now let's talk timing. When can you expect to see results? Honestly, this varies from person to person, but here's what I typically see in my practice. Within 7 to 14 days, many men notice better warmth in the area, improved morning erections, or more responsiveness. Between week 3 and week 6, a lot of guys report more stable erections and significantly less anxiety going into intimate moments. These are averages, not guarantees. If you don't see any improvement after 6 weeks, please come back to me. Well, not literally to me, but go see your physician. There may be other factors at play, like prostate issues, hormone imbalances, medication interactions, or vascular conditions that need medical attention. I've had patients discover low testosterone, undiagnosed diabetes, or even early heart disease through this process, so don't view a lack of progress as failure. View it as valuable information that points you toward the next step. Let me also talk about how to combine this with other healthy habits, because the massage by itself is just one piece. Move your body every day, even if it's just a 15 to 20-minute walk around the neighborhood. Drink water throughout the day in small sips rather than chugging it all at once. Keep dinner light and don't overeat right before bed. Cut back on alcohol and caffeine in the evening, because both of these mess with your sleep and your sexual function. Better sleep and better blood pressure equal better intimate health. There's no way around it. If you're using medications like Viagra, Cialis, or Levitra, the massage doesn't replace them. It actually enhances their effectiveness. Coordinate the timing with your doctor. Take them on a relatively empty stomach, and avoid spicy or heavily processed foods that can interfere with absorption. Now, I want to take a few minutes to answer some questions I've been getting from you in the comments, because some really important issues have come up. Several of you have mentioned issues with pre-ejaculate fluid not appearing the way it used to. This is actually quite common with age and is often related to prostate function and hydration levels. If this is a concern for you, please get a prostate exam. It should be part of every man's regular checkup after age 50 anyway, and after 60, it becomes even more important. A simple PSA blood test and a conversation with your doctor can give you a lot of clarity. Another viewer mentioned feeling like at 60 it's all over, like the desire is just gone for good. I want to push back on that with everything I've got. After 2 decades of practice, I can tell you that I've seen men in their 70s and 80s who are happier and more satisfied in their intimate lives than they were in their 40s. The body changes, yes, but it doesn't stop working. It just needs different care, different attention, and the kind of patience that frankly only comes with age and wisdom. I've also gotten questions about sleep. Trouble sleeping is a huge factor in sexual health, and I want to do a separate video on that soon. For now, focus on a consistent bedtime, no screens for an hour before bed, and keep your bedroom cool and dark. If you're snoring loudly or waking up exhausted, get checked for sleep apnea. It's far more common than people realize, and it absolutely tanks testosterone levels. Let me give you a simple 7-day starter plan to make this easy. Day 1 and 2. Just do the short 10-minute routine focused on breathing and rhythmic pressure. Get comfortable with the basics. Day 3. Add in the ring slide. Day 4. Add perineal stimulation. Day 5. Repeat whatever felt best to you so far. Day 6. Add a 15-minute walk before your session. Get the blood moving first. Day 7. Reflect. What improved? What needs adjustment? When does this fit best in your day? Keeping a simple journal of how you're doing can be incredibly motivating. Just a few sentences each day. It gives you control, and helps you see progress that you might otherwise miss. When should you absolutely stop and call your doctor? If you experience increasing pelvic pain, fever, blood in your urine or semen, persistent numbness or sharp pain during massage, stop immediately and get medical attention. If you're being treated for cancer, taking blood thinners, or have had recent pelvic surgery, talk to your physician before you start any of this. I want to leave you with something important. Sexuality in your later years isn't a worse version of what you had when you were 25. It's a different version, a more conscious, more aware, more meaningful version. With patience, with the right habits, and with techniques like the ones we covered today, your body can absolutely learn to respond again. Every step you take reduces stress, improves circulation, and brings back what you want: the firmness, the control, the pleasure, all in a safe and healthy way. You don't have to accept the idea that this part of your life is over. It isn't. I've seen too many men reclaim what they thought they'd lost forever to believe that for 1 second. The fact that you're here, watching this video, doing your research, taking action, that tells me you've got everything you need to make real progress. If this content was helpful to you, do me a favor and hit that like button, subscribe to the channel, and ring the notification bell so you don't miss future videos. Share this with a friend or family member who might benefit. And please drop a comment below telling me what step you're going to take this week. I read every single comment, and I'll be right here with you on this journey. Take care of yourselves, take care of each other, and I'll see you in the next video. This is Dr. Grace Holloway, signing off.